हेलो फ्रेंड्स, आज के इस वीडियो में हम ब्लड डिसऑर्डर एनीमिया के बारे में पढ़ेंगे। एनीमिया इज अ ब्लड डिसऑर्डर कैरेक्टराइज्ड बाय द रिडक्शन इन आरबीसी, रेड ब्लड काउंट्स में रिडक्शन होगा, हीमोग्लोबिन कंटेंट में भी रिड्यूस्ड और द पैक्ड सेल वॉल्यूम is also reduced. Reduction in RBC count or hemoglobin content or PCV may occur because of the decreased production of RBC or increased destruction of RBC or excess loss of blood from the body. Classification of anemia. Anemia can be classified by two methods. First is the morphological classification, second is the etiological classification. फर्स्ट वी विल टॉक अबाउट द मॉर्फोलॉजिकल क्लासिफिकेशन। तो जो मॉर्फोलॉजिकल क्लासिफिकेशन होता है, इट डिपेंड्स अपॉन द साइज एंड द कलर ऑफ द आरबीसी। कलर ऑफ द आरबीसी, आरबीसी का साइज कैसा है, आरबीसी का कलर कैसा है, उस अकॉर्डिंग टू दैट इस एनीमिया को हम क्लासिफाई करते हैं। एंड दिस इज क्लासिफाइड इनटू द 4 टाइप्स. First is the normocytic normochromic anemia. Second is the macrocytic normochromic anemia. Third is the macrocytic hypochromic anemia. And fourth is the microcytic hypochromic anemia. Now we will see each type of this anemia individually. First, we will see the normocytic normochromic anemia. As the name suggests, the normocytic, normo means normal, cytic means size, मतलब size है, size will be normal. Normochromic, normo means normal, chromic means color, so color is also normal. तो आरबीसी का साइज नॉर्मल है, कलर भी नॉर्मल है, but the number of RBC is less. That's why there is decrease in the RBC count. So next is the macrocytic normochromic anemia. Macro means large, cytic is size, so RBCs are large in size. Normochromic, that means with normal color, but the size of the RBC is large and RBC count is less. Macrocytic hypochromic anemia. Macrocytic, that is the RBCs are larger in size. Hypochromic means the color of RBC is less, so the cells of RBCs are pale in color. Next is the microcytic hypochromic anemia. Micro, the size of the RBCs are smaller. Hypochromic, that is that color is less. Now we will see the second classification, that is etiological classification of anemia. This is based on the cause of the anemia and it is divided into 5 types. First is the hemorrhagic anemia, second is the hemolytic anemia, third is the nutritional deficiency anemia, fourth is aplastic anemia, and fifth is the anemia of chronic disease. First is the hemorrhagic anemia. Hemorrhagic anemia refers to excess loss of blood. There is excessive loss of blood. Anemia due to hemorrhage is also known as hemorrhagic anemia and it occurs in both acute and chronic hemorrhagic conditions. So, when it occurs in acute condition, it is called as acute hemorrhage, and when it occurs in chronic conditions, it is called as chronic hemorrhage. Acute hemorrhage refers to a sudden loss of large quantity of blood, as in case of accident. Suddenly accident happens and there is sudden loss, excessive loss of blood in a very short period of time. Chronic hemorrhage refers to loss of blood by internal or external bleeding over a long period of time. It occurs in conditions like peptic ulcer, purpura, hemophilia, menorrhagia. Due to continuous loss of the blood, lots of iron is lost from the body, causing iron deficiency, and this affects the synthesis of hemoglobin, resulting in less hemoglobin content in the cell. The cells also become small, hence the RBCs are microcytic and hypochromic. Second is the hemolytic anemia. Hemolysis means destruction of RBC. Anemia due to excessive hemolysis, which is not compensated by increased RBC production, is called hemolytic anemia. It is classified into two types: extrinsic hemolytic anemia and intrinsic hemolytic anemia. Extrinsic hemolytic anemia is the type of anemia caused by destruction of RBC by external factors. Healthy RBCs are hemolyzed by the factors outside the blood cells, such as antibodies, chemicals, and drugs. Extrinsic hemolytic anemia is also called autoimmune hemolytic anemia. Some of the common causes that leads to external hemolytic anemia are liver failure, renal disorder, hypersplenism, burns, infections like hepatitis, malaria, septicemia, then drugs like penicillin, antimalarial drugs, and sulfa drugs leads to extrinsic hemolytic anemia. Then poisoning by chemical substances like lead, coal, and tar, and presence of isoagglutinins like anti-RH. Then autoimmune diseases such as rheumatoid arthritis and ulcerative colitis may lead to extrinsic hemolytic anemia. Next is the intrinsic hemolytic anemia. Intrinsic hemolytic anemia is a type of anemia caused by destruction of RBC because of the defective RBCs. There is a production of unhealthy RBCs which are short-lived and are destroyed soon. Intrinsic hemolytic anemia is often inherited. It includes sickle cell anemia and thalassemia. Because of the abnormal shape in sickle cell anemia and thalassemia, the RBCs become more fragile and susceptible for hemolysis. Sickle cell anemia is an inherited blood disorder characterized by sickle shaped RBC. जो नॉर्मल शेप होता है आरबीसी का विच इज बाइकॉनकेव is get converted into sickle shaped. It becomes like this, sickle cell shaped हो जाता है आरबीसी का. Sickle cell anemia is also called as hemoglobin SS disease or sickle cell disease, and it is common in people of African origin. Sickle cell anemia is due to abnormal hemoglobin called as hemoglobin S. In this case, the alpha chains are normal, but the beta chains are abnormal. Because of this, the RBC attain the sickle, that is the crescent shape, and become more fragile, leading to hemolysis. Sickle cell anemia occur when a person inherits the two abnormal genes, one from each parent. Next is the thalassemia. Thalassemia is also an inherited blood disorder characterized by abnormal hemoglobin, and it is also known as Cooley's anemia or Mediterranean anemia. It is more common in Thailand and to some extent in Mediterranean countries. Thalassemia is of two types: alpha thalassemia and beta thalassemia, out of which the beta thalassemia is more common. In normal hemoglobin, the alpha and the beta polypeptide chains is equal. Means alpha polypeptide chain is equal to beta polypeptide chain. But in thalassemia, the production of this chain become imbalanced because of the defective synthesis of globin gene. There is defective synthesis of globin gene, because of which there is imbalance between the synthesis of alpha polypeptide chains and beta polypeptide chains. This causes the precipitation of polypeptide chains in immature RBC, leading to disturbances in erythropoiesis. Next is the nutrition deficiency anemia. Anemia that occurs due to deficiency of nutritive substances necessary for erythropoiesis like iron, protein, vitamins like vitamin C, vitamin B12 and folic acid may lead to this type of anemia. The types of nutrition anemia are iron deficiency anemia, protein deficiency anemia, pernicious anemia, which is also called as Addison's anemia, and megaloblastic anemia.